Mrs. Wees? Are you Mrs. Wees?
I am.
Hi, I'm your nurse today.
Oh, it's so nice to meet you.
You can follow me. We're going to go into the exam room.
Okay.
It's a long trek up there, so... Are you okay?
Yeah, just a minute. I just have to catch my breath for a little.
Okay, just take your time.
Thank you, dear young one.
Alright, we're going to go right in here.
Okay.
Are you okay?
Yeah.
We're almost there.
Okay.
Oh, you sat down again on me.
I'm coming. Here I come.
Alright, before we sit down again, I need to measure you and weigh you. So can you just step against the wall?
Yes. Yes.
Okay. You're about 5'9". And can you step on the scale for me?
Sure.
Okay, 106.
Oh, great.
Alright. So, what brings you in today? I'm just going to take your blood pressure.
Oh, okay. It's been a long time for me. I'm a little nervous about today.
What's that?
Yell at me for being a smoker.
Oh, okay. Well, can you tell me a little bit about your history?
I've smoked for 18 years.
Well, actually, I think I have in my charts that you've been smoking for about 55 years.
I might have forgot a few.
Oh, okay.
I do smoke quite
How
often.
much do you smoke a day?
About a pack
Okay.
or two, maybe 3.
Let me just take your blood pressure real quick. Alright.
Healthy as a horse.
122 over 70.
Oh dear, that's my good sweater.
Alright. I'm just gonna sit down here and talk with you for a
Let
minute.
me move my things.
So, you've been smoking for 55 years, about a pack a day?
That's what they tell me.
Okay, so what brings you in today?
About 6 months ago, I got a bad case of bronchitis.
I believe you were in here about 6 weeks ago, according to
Give
my
or take,
records.
probably about 6 weeks ago. Then they said I had bronchitis. Do you know what that
Okay.
is?
Yes, it's inflammation of the bronchial tubes.
Oh yes, that's what
Well,
I had.
given your history and that you're a smoker,
I
since you've had persistent coughs for the past 2 years and cases of bronchitis, I believe we're going to be testing you today for COPD.
What's that now?
It is chronic obstructive pulmonary disease, and I have in here that you're here because you're coughing up mucus, you're wheezing, and are you getting tired, shortness of breath, and getting tired when you're walking short distances?
Yes, I cannot knit because my yarn balls keep rolling away and I can't chase them.
Oh, okay.
I think it's my old age.
It could be. Alright, well, COPD is oftentimes caused by smoking,
I've done that.
and you are a smoker, so we're going to test you for that today and see what it tells us.
I like to clean
You do like to clean?
with lots of chemicals.
Oh, okay. What kind of chemicals?
All kinds.
Okay. Well,
Would that cause my COPD?
it could. some chemicals can cause COPD. Most of the time it's from smoking, but chemicals can play a factor into that too. So we might have to take a look at that as well. Do you have any other questions for me right now?
Will it go away?
It's not curable, but it's treatable, and we can give you medicines such as bronchodilators or corticosteroids to help treat it.
I like treats.
So we can try to treat it for you, but it will never be cured.
Oh.
But let's take it one step at a time because we don't even know if you have it yet. So.
Okay.
Okay? I'll send Dr. Lung right in to see you.
Thank you.
Knock, knock. Hello, Miss Wheeze. I'm Dr. Long. How are you?
Nice to meet Dr. Long. I am Mrs. Wheeze.
Nice to meet you, Mrs. Wheeze. Can you tell me what brought you in here today?
I cannot knit.
You can't knit.
Not anymore.
What's wrong?
You see, I can't seem to catch my breath.
Yeah? And that's affecting your knitting?
I can't chase my yarn balls.
Oh, your yarn balls get away from you.
All the time.
Those dagnab balls.
All the time, dear.
So what other times do you have trouble breathing?
All day long. I feel like I run a marathon.
You feel like you run a marathon all day.
Yeah.
Anything help it? Anything make your breathing easier?
Coughing.
Coughing? Do you cough stuff up?
Yes. Gross stuff.
Gross stuff. What do you mean by gross?
It's sticky.
Ah, yes. Well, because, and you smoke, right?
Well, no. Occasionally. Sometimes I smoke multiple times a day.
Oh, yeah. Well, I think that your history says that you've smoked quite a lot.
That's what they tell me. Oh, this effort.
Oh, Mrs. Wheeze, we can't have you smoking in here.
I brought my ashtray.
You brought but Mrs. Wheeze, I think you should put it in that ashtray. There's people on oxygen. This is the respiratory floor. I'm going to have to ask you to put that out.
Oh, sorry. Sorry.
So I take it you're still smoking, and you've smoked for how many years now?
They tell me 15.
15? Well, your chart says 55.
Perhaps I forgot to count a few.
Ah, yes. Well, we're concerned with these infections that you've been having over the past couple years, and your breathing.
I've had infections.
Yeah, you've had those bronchitis and the respiratory, the breathing infections.
I did have bronchitis.
Yeah, a couple of times in the past couple of years. And you have this cough that just won't go away, and you have shortness of breath, and you know what? You've been a smoker, so we're worried about you having COPD, which is that chronic obstructive pulmonary disorder.
Oh.
So I have this test for you that we're going to try, and we're going to run some tests today. I think we're going to get some blood from you also, but it's called an incentive spirometer. Here it is, incentive spirometer. So what I'm going to have you do is I'm going to have you breathe in, and I want you to just keep your breath as long. Oh, not yet, not yet. I'm going to have you. I'm going to tell you what to do, and then I'll ask you to do it in a minute. I'm going to have you breathe in, and I want you to make a nice long blow out, like you're blowing out a candle, and I want you to blow out all of your breath into this, and I'll get a reading from that, and we'll see how you're doing. So ready? We're going to have you take a deep breath in. Put your mouth on there, and then blow it out like you're blowing a candle. Very good.